Have you ever had a quiet moment when something about your health did not feel quite right, even though there was no obvious warning? One of my patients once shared that she felt completely fine, yet something deep inside told her to pay closer attention. I want you to imagine this for a moment. Your day feels normal, your routine is steady, but a silent process is unfolding beneath the surface. My name is Dr. Evelyn Carter, and I am honored you are here with me on Senior Health Daily. After decades of caring for older adults, I have learned that some of the most serious health conditions do not arrive with noise or drama. They arrive quietly, asking us to listen rather than panic. Today, we are talking about the connection between Nipah virus and encephalitis, and why doctors take this link seriously while still encouraging calm understanding. Nipah virus is rare, but it draws medical attention because of how it can affect the brain. Encephalitis means inflammation of the brain, and when inflammation involves such a sensitive organ, doctors move carefully and thoughtfully. The phrase silent but deadly does not mean sudden danger. It means that changes can begin slowly, sometimes without clear early signs, especially in older adults whose bodies have learned to compensate quietly over time. In my clinical experience, many neurological conditions start this way. A small change in alertness, a subtle shift in balance, or a feeling that thinking takes a bit more effort than usual. These are not reasons to feel afraid. They are reasons to become informed. Simple science tells us that the brain responds best when it feels safe, supported, and understood. Understanding this connection is not about expecting the worst. It is about recognizing patterns early and respecting how the brain communicates. When seniors and caregivers understand what doctors are watching for, they gain confidence instead of anxiety. If you value calm and trustworthy guidance like this, please take a moment to like this video, share it with someone you care about, and subscribe to Senior Health Daily. Your support helps us continue creating thoughtful health conversations made especially for you. In the next part, we will gently explore how encephalitis develops, why it can progress quietly, and what awareness really means for protecting brain health without fear. What encephalitis really is. When people hear the word encephalitis, it can sound technical and distant. In everyday terms, encephalitis means inflammation of the brain. Inflammation is the body's natural response to stress or infection. It is the same protective process that causes swelling when you twist an ankle. The difference is that the brain has very little room to tolerate swelling or irritation. Even small changes can affect how clearly it thinks, how steadily the body moves, and how alert a person feels. The brain is the most sensitive organ we have. It relies on precise communication between billions of nerve cells. When inflammation enters this environment, those messages can slow down or become disrupted. A person may not feel pain in the way they expect. Instead, they might notice confusion, unusual sleepiness, trouble focusing, or changes in balance. These signs can be subtle at first, which is why encephalitis can progress quietly. For older adults, this sensitivity matters even more. As we age, the brain becomes less flexible in how it responds to stress. It is still capable and resilient, but it may take longer to recover from disruption. Blood flow may not adjust as quickly. The immune response may linger longer than it should. These changes do not mean weakness. They simply mean the brain needs more time and more gentle support. In my clinical experience, I have seen older patients dismiss early symptoms because they did not feel dramatic. They thought feeling a bit off was part of aging or a poor night of sleep. Sometimes that is true, but sometimes the brain is signaling that it needs attention. Encephalitis does not always announce itself with a sudden crisis. It often begins with small shifts that are easy to overlook. This is why doctors take encephalitis seriously, especially when it is linked to an infection that can affect the nervous system. The concern is not meant to create fear. It is meant to encourage awareness. When inflammation affects the brain, timing matters. Early recognition allows the body to be supported before complications develop. I want to emphasize something important. Encephalitis is not a diagnosis you make at home. And noticing a symptom does not mean it is present. Many common conditions can cause similar feelings. What matters is understanding why doctors pay attention to the brain and why they encourage calm observation rather than panic. For seniors and caregivers, this knowledge provides reassurance. It explains why subtle changes deserve gentle attention, not alarm. When you understand what encephalitis really is, you are better equipped to notice patterns, ask thoughtful questions, and support brain health with patience and confidence. How Nipah virus reaches the brain. When people hear that a virus can affect the brain, it is natural for the imagination to run ahead. I want to slow that moment down and explain this pathway in a calm and grounded way. Understanding how a virus reaches the nervous system is not about picturing danger. It is about understanding process, because process brings perspective. Most viruses, including Nipah virus, begin their interaction with the body in very ordinary places. They enter through common routes, such as the nose or mouth, and first encounter the immune system there. In many cases, the immune response is enough to contain the situation early, sometimes without a person ever realizing the virus was present. This is an important and reassuring point. The body is not passive. It is actively protecting itself from the very beginning. In rare situations, certain viruses are able to move beyond these initial defenses. They may travel through the bloodstream or along nerve pathways that naturally connect different parts of the body. Doctors pay attention to Nipah virus because research has shown that, under specific conditions, it can reach areas that influence brain function. This does not happen quickly, and it does not happen easily. Multiple layers of protection stand in the way. The brain itself is guarded by a special barrier designed to keep harmful substances out. This barrier works remarkably well. For a virus to affect the brain, several factors must align, including the strength of the immune response and the overall condition of the body. In older adults, these systems still work, but they may respond at a different pace. That difference in timing is one reason doctors monitor neurological symptoms with care rather than urgency. From my experience caring for seniors, I have seen how the nervous system often signals stress before a serious problem develops. These signals are not dramatic. They may be subtle changes in alertness or coordination. This is why awareness matters more than fear. When changes are noticed early, support can begin early as well. It is also important to understand that the brain has a remarkable ability to adapt. Even when it is under stress, it works hard to maintain function. This adaptability is one reason symptoms can appear gradually rather than suddenly. The brain compensates quietly, often for quite some time. Explaining this pathway is meant to empower you. Knowing that there are many protective steps along the way helps place risk in context. Doctors study these pathways so they can protect patients better, not because they expect the worst to happen. When seniors and caregivers understand how the body works with care and balance, the nervous system feels safer, and that sense of safety supports clearer thinking and better outcomes. Why Nipah virus can cause encephalitis. When we talk about why Nipah virus can cause encephalitis, it helps to think in simple biological terms, rather than medical jargon. Encephalitis happens when the brain becomes inflamed. Inflammation is not the enemy. It is the body's way of responding to something it believes should not be there. The challenge arises because the brain is extremely sensitive to this response. In some rare situations, Nipah virus can trigger an immune reaction that involves the tissues supporting the brain. The virus itself does not need to damage large areas to cause problems. Even a small amount of inflammation can interfere with how nerve cells communicate. Signals may slow down. Timing can feel off. A person may experience changes in alertness, coordination, or thinking that seem out of proportion to how mild everything else feels. A helpful way to understand this is to compare Nipah virus to viruses people already know. Many seniors remember having the flu and feeling mentally foggy or unusually tired. That fog is not because the flu is attacking the brain directly in most cases. It happens because inflammation affects the whole body, including the nervous system. The brain temporarily works in a less efficient environment. Once inflammation settles, clarity usually returns. Another example is shingles, which can irritate specific nerve pathways and cause lingering discomfort or sensitivity. In that case, the virus interacts with nerves in a targeted way. Nipah virus draws medical attention because, in rare circumstances, it can involve the central nervous system more directly, creating inflammation within or around brain tissue. This does not mean it behaves aggressively in every person. It means doctors remain attentive to its neurological potential. From a scientific perspective, the immune response plays a central role. The brain depends on balance. When inflammation lingers or becomes intense, that balance is disrupted. Older adults may feel this more strongly because their brains are already adapting to age-related changes. Recovery is still possible, but it may take more time and support. In my clinical experience, the most important factor is not fear, but timing. The nervous system often compensates quietly. It tries to maintain normal function even when under stress. This is why early symptoms can be subtle rather than dramatic. A person might feel slower mentally or more tired than usual without understanding why. Doctors study viruses like Nipah virus closely so they can recognize these patterns early. The goal is not to expect encephalitis, but to be prepared for it. Understanding why encephalitis can occur helps remove mystery from the process. When mystery fades, fear often follows. What remains is awareness, patience, and respect for how the brain responds to stress. This understanding supports calm observation. It allows seniors and caregivers to notice changes without panic, and to trust that medical care is focused on protection, not alarm. Silent progression in the nervous system. One of the most challenging aspects of brain-related conditions is that they often progress quietly. The nervous system is designed to protect function, not to create noise. When something begins to interfere with how the brain works, the brain does not immediately sound an alarm. Instead, it adapts. It compensates. It finds alternate pathways to keep daily life moving forward. This is why brain involvement can develop without obvious warning signs. The brain has a remarkable ability to adjust to stress. If one area is under strain, other areas may temporarily take on more work. From the outside, everything can look normal. Inside, the nervous system is working harder than usual to maintain balance. That extra effort is often invisible, especially in the early stages. In older adults, this quiet compensation is even more common. With age comes experience, and the brain has learned many ways to adapt. Seniors often push through subtle changes without complaint. They may slow down slightly, rest more often, or avoid activities that suddenly feel demanding. These adjustments can happen so gradually that neither the person nor their family recognizes them as changes. In my years caring for older patients, I have seen this pattern repeatedly. A family member might say, "Something just feels different, but I cannot explain why." A spouse may notice that conversations feel shorter, or that decision-making takes more time. A caregiver may see hesitation where confidence once lived. None of these observations feel urgent on their own, but together they tell a story. The reason this matters is not to create worry, but to encourage gentle awareness. Silent progression does not mean inevitable harm. It means the brain is managing stress quietly. When that stress is relieved early, the nervous system often recovers more smoothly. Another reason progression can be silent is that the brain itself does not feel pain in the same way other organs do. You do not feel inflammation in the brain the way you feel inflammation in a joint. Instead, you experience changes in function. Those changes can be subtle and easy to explain away. This is why doctors caring for seniors listen carefully to descriptions rather than waiting for dramatic symptoms. We pay attention to patterns over time. We look for consistency rather than isolated moments. A single day of confusion is not alarming. A gradual shift over weeks deserves attention. Understanding silent progression helps replace fear with respect. The brain is not fragile. but it is sensitive. When you learn how quietly it can signal stress, you become better equipped to notice those signals with patience rather than panic. That calm awareness allows care to begin at the right pace and supports the nervous system in returning to balance whenever possible. Early brain and behavior changes. When the brain is under stress, it rarely announces that stress in a dramatic way. More often, it communicates through small, easily overlooked changes. These early shifts are not diagnoses. They are signals that deserve gentle attention, especially in older adults whose brains may already be working harder to maintain balance. One of the most common early changes involves memory. This does not mean forgetting major events or loved ones. It may look like needing more time to recall a word, losing a train of thought mid-sentence, or feeling mentally tired after conversations that once felt easy. Many seniors assume this is simply aging, and sometimes it is. But when these changes feel new or noticeably different, they are worth observing. Alertness can also shift subtly. A person might feel unusually drowsy during the day or have trouble staying focused on tasks they normally enjoy. Others describe feeling mentally slowed, as if their thoughts are moving through fog. These experiences can come and go, which is why they are easy to dismiss. The brain often fluctuates as it compensates, creating good days and less clear days. Behavioral changes can be just as quiet. A normally patient person may become slightly irritable. Someone who enjoys social interaction may begin to withdraw or prefer silence. Decision-making might take longer, or confidence may seem reduced. These are not character changes. They are functional responses. The brain conserves energy by narrowing focus when under strain. From a caregiving perspective, these changes are often noticed before the person experiencing them recognizes anything unusual. A caregiver might sense that routines are taking more effort, or that instructions need to be repeated gently. These observations are valuable. They provide context that no test can capture on its own. I want to be very clear about something important. Experiencing any of these changes does not mean encephalitis is present. Many common conditions can cause similar symptoms, including dehydration, poor sleep, medication side effects, stress, or minor infections. That is why doctors never rely on a single symptom. We look at patterns, timing, and overall health. In my practice, I encourage seniors and caregivers to think in terms of noticing rather than labeling. Notice what feels different. Notice whether changes persist, improve, or gradually increase. This approach reduces fear while supporting awareness. It keeps the nervous system calmer, which is beneficial in itself. The goal of recognizing early changes is not to jump to conclusions. It is to stay connected to the body's signals. When attention is given early, support can begin early, even if that support is as simple as rest, hydration, or reassurance. The brain responds best when it feels heard rather than rushed. By understanding these early signs as information rather than threats, seniors and caregivers can remain calm partners in health. That calm partnership allows medical care to be thoughtful, measured, and centered on the whole person rather than a single concern. Before we continue, I want to pause for a moment and speak with you directly. Taking in information about the brain and nervous system requires focus, and I appreciate that you have stayed present with me. That tells me you care about understanding your health in a thoughtful and steady way, not out of fear, but out of respect for your body. Many of the people I have cared for over the years have shared that what they value most is not fast answers, but clear explanations delivered with patience. That is exactly why Senior Health Daily exists. This space was created for seniors and caregivers who want medical guidance that feels calm, human, and trustworthy. Health conversations should support you, not overwhelm you. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. When you subscribe or share a video like this, You help extend that sense of reassurance to others who may be quietly searching for answers. A caregiver looking for clarity. A spouse trying to understand subtle changes. A senior who has read something alarming and needs context rather than urgency. Your small action helps build a larger community where health is discussed with care. I want you to know that engagement is not about numbers alone. It is about choosing a different tone for health information, one that values dignity, understanding, and emotional safety. Every like and every share tells us that this approach matters. Thank you for being here and for allowing this conversation to unfold at a gentle pace. Your presence supports the kind of learning environment where the brain feels safe enough to absorb information clearly. With that shared foundation of trust, we can continue exploring this topic with confidence and calm. Encephalitis risk in older adults. When older adults hear the word encephalitis, it often triggers an immediate sense of concern. That reaction is understandable. Over time, many seniors have witnessed serious illness in friends or family, and the brain feels deeply personal. Anything involving memory, thinking, or independence naturally touches a sensitive place. From a geriatric perspective, this worry is not a sign of weakness. It is a sign of awareness and lived experience. One reason encephalitis sounds especially alarming to seniors is because the brain represents autonomy. The ability to think clearly, make decisions, and recognize loved ones is closely tied to dignity. When that feels threatened, fear can rise quickly. Headlines and medical terms can unintentionally magnify that fear by focusing on worst-case scenarios rather than typical experiences. In geriatrics, we approach risk differently. We do not look at age alone. We look at function, resilience, and support. Many older adults have brains that are highly adaptable. They may process information a bit more slowly, but they often compensate with experience and routine. This adaptability is a strength. It allows the brain to adjust under stress more gracefully than many people expect. It is also important to understand that encephalitis related to infections like Nipah virus is rare. Doctors monitor the possibility not because it is common, but because the consequences of missing early signs can be serious. Monitoring is an act of care, not a prediction. It reflects attentiveness, not inevitability. From my clinical experience, seniors often do better when they feel informed rather than alarmed. When they understand that risk exists on a spectrum, their nervous systems settle. Calm allows the brain to function more efficiently. Stress, on the other hand, can worsen confusion, sleep problems, and balance issues even in the absence of serious illness. This is why reassurance is not just emotional comfort. It is part of good medical care. Careful observation and early communication with healthcare providers make a meaningful difference. Older adults who feel supported are more likely to mention subtle changes and ask questions. That openness helps doctors respond appropriately and proportionately. The goal of discussing encephalitis risk is not to burden seniors with worry. It is to offer realistic understanding. Awareness paired with calm creates confidence. Confidence supports resilience. And resilience is one of the most powerful protective factors in healthy aging. When older adults feel respected and understood, they are far better equipped to navigate health information without fear and to trust their bodies as capable partners in care. Brain inflammation and recovery. To understand recovery, it helps to first understand inflammation in simple terms. Inflammation is the body's way of responding to stress, injury, or infection. It is a protective reaction, not a failure. When inflammation occurs in a joint, we may see swelling and warmth. When it occurs in the brain, the signs are quieter and more functional, such as changes in thinking, alertness, or coordination. The process is the same, but the environment is far more delicate. The brain does not like prolonged inflammation, but it is also remarkably capable of healing when conditions are right. Recovery depends on many factors, including how early the inflammation is recognized, how well the body is supported, and how calm the surrounding environment remains. This is especially important for older adults, whose brains may take longer to settle after stress, but can still regain balance with proper care. One of the most reassuring truths I share with patients is that the brain is always working toward stability. Even when inflamed, it is actively trying to protect vital functions. This is why rest, hydration, and gentle support matter so much. These simple measures reduce background stress and allow the brain's natural repair processes to work more efficiently. Early care plays a powerful role. When changes are noticed and discussed promptly, doctors can evaluate whether inflammation is present and determine the appropriate level of support. Early care does not always mean aggressive treatment. Often, it means careful monitoring, adjusting medications, managing sleep, and ensuring nutrition and fluids are adequate. These steps may sound modest, but they create the conditions the brain needs to recover. The emotional environment is just as important as the physical one. The nervous system responds to safety. Loud worry, constant questioning, or pressure to perform can increase stress hormones that interfere with healing. In contrast, calm reassurance, predictable routines, and clear communication signal safety to the brain. This sense of safety helps reduce inflammation over time. In my experience caring for seniors, recovery is often smoother when caregivers and patients understand this connection. When fear is reduced, cooperation improves. When cooperation improves, outcomes often follow. The brain does not recover well in chaos, but it responds positively to steadiness. It is also important to remember that recovery is rarely linear. There may be good days and slower days. This variability does not mean failure. It reflects the brain adjusting and recalibrating. Patience during this process is a form of care. Understanding brain inflammation and recovery replaces urgency with confidence. It reminds seniors and caregivers that healing is possible and that early, gentle support makes a real difference. When the brain feels protected rather than pressured, it is far more capable of finding its way back to balance. The role of caregivers. If you are a caregiver, I want to speak to you directly for a moment. Your role in situations involving brain health is profoundly important, even when it feels quiet or unnoticed. You are often the first to sense that something is slightly different, long before words or tests can explain it. That awareness is not accidental. It comes from presence, familiarity, and care. Caregivers see patterns that others may miss. You notice when routines take more effort, when responses are slower, or when a loved one seems more tired after ordinary activities. These observations matter. They provide context that no medical chart can fully capture. In my experience, some of the most helpful information I receive as a physician comes from caregivers who gently describe changes over time, rather than dramatic moments. Observation alone, however, is not enough. Patience is what allows observation to become useful. Brain-related changes rarely move on a clear schedule. There may be days when everything feels normal and days when something feels off. Caregivers who remain patient through these fluctuations help reduce pressure on the person they are supporting. That reduction in pressure is not just emotional comfort. It directly affects how the nervous system functions. Communication is the bridge that connects observation and care. Open, respectful conversations allow concerns to surface without creating alarm. Asking simple questions, listening without interruption, and validating feelings can prevent fear from taking root. When caregivers speak calmly, the brain receives a signal of safety. That signal supports clearer thinking and steadier behavior. I have seen caregivers unintentionally increase stress by rushing explanations or insisting on constant reassurance. While the intention is loving, the effect can be overwhelming. Gentle pacing often works better. Sharing information in small pieces, checking for understanding, and allowing time for rest can make a significant difference. Caregivers also play a crucial role in communicating with healthcare providers. You help translate daily experiences into meaningful information. When you describe what you see without judgment or urgency, doctors can respond more accurately. This partnership improves care and prevents unnecessary interventions. It is equally important for caregivers to care for themselves. Carrying concern without support can lead to exhaustion, which makes patience and communication harder. Taking breaks, asking questions, and choosing reliable sources of information are acts of responsibility, not weakness. Your presence shapes the environment in which healing or adaptation occurs. A calm caregiver helps create a calm nervous system. A patient caregiver supports resilience. And a communicative caregiver builds trust between everyone involved. In brain health, outcomes are influenced not only by biology, but by relationships. Your role is not to fix or predict. It is to notice, to stay steady, and to communicate with care. That role is powerful, and it deserves recognition and respect. Why awareness matters more than fear. As we bring this main discussion toward a close, I want to gently return to the idea that has guided every part of our conversation. Awareness protects the brain far more effectively than fear ever could. Fear tightens the nervous system. It narrows attention and pushes the body into a state of constant alert. Awareness, on the other hand, opens space for observation, communication, and timely care. In my years of working with older adults, I have seen how fear can quietly interfere with health. When people are frightened, they may avoid asking questions or delay mentioning small changes because they do not want to hear bad news. Ironically, that delay is what creates risk. Awareness does the opposite. It invites curiosity. It encourages people to notice patterns and speak up early when support is most effective. Understanding how conditions like encephalitis can develop does not mean expecting them to happen. It means knowing what doctors are watching for and why. That knowledge allows seniors and caregivers to respond thoughtfully rather than react emotionally. When the brain feels safe, it functions more clearly. This is not just a comforting idea. It is supported by simple neuroscience. Chronic stress releases hormones that interfere with memory, focus, and balance. Calm understanding helps restore equilibrium. Awareness also changes the quality of conversations with healthcare providers. Instead of arriving with fear-driven questions, patients and caregivers arrive with observations. They can say, "This feels different than usual," or "This change has been gradual." These kinds of conversations lead to more accurate care because they are grounded in experience rather than alarm. Another important aspect of awareness is recognizing limits. No one needs to carry every piece of information all at once. Learning can happen in layers. It is enough to understand the basics, to know when to pay attention, and to trust that medical guidance is available when needed. The brain responds well to information that is paced and respectful. For older adults, this approach supports dignity. It affirms that aging does not mean fragility. It means adaptation. The brain has adapted to many challenges already, and it continues to adapt when given the right environment. Awareness honors that capacity. Fear undermines it. As we prepare to move into the closing, I want you to hold on to this steady truth. Knowledge should feel like a companion, not a burden. It should help you stand on solid ground rather than push you into worry about what might happen. When information is received calmly, it strengthens confidence and supports better outcomes. You have taken the time to understand rather than rush to conclusions. That choice matters. It creates the emotional foundation for everything that follows. In the closing, we will slow the pace even further and bring this conversation to a place of reassurance and gratitude, so you can leave feeling supported and at ease. Thank you for staying with me until the end of this conversation. Your time and your attention matter, and I do not take either lightly. Choosing to listen calmly and thoughtfully is an act of care for yourself and for those you love. Understanding Nipah Virus encephalitis is not a story about fear. It is a story about awareness. When we understand what doctors are watching for and why, the unknown becomes less threatening. Knowledge gives shape to uncertainty. It helps the mind stay steady and allows the body to remain at ease. This kind of understanding does not rush you. It supports you. To the older adults watching, I want to offer gentle reassurance. Your brain responds best when it feels safe and respected. It works more clearly when it is not pressured by worry or urgency. Calm awareness supports balance, memory, and resilience. Your body has carried you through many seasons, and it continues to respond positively when it is met with patience and trust. To the caregivers, thank you. Your quiet presence, your careful observation, and your willingness to listen make a profound difference. You help turn information into understanding and concern into reassurance. Your patience creates an environment where the nervous system can settle and healing or adaptation can unfold more smoothly. As we close, I invite you to remember this simple truth. Knowledge should bring reassurance, not pressure. Health conversations should leave you feeling supported, not overwhelmed. If you ever need a place where medical guidance is offered with calm and compassion, Senior Health Daily will be here for you. You are always welcome to return, to listen, to reflect, and to learn at your own pace. Until then, take a gentle breath. Thank your body for the work it does each day, and allow yourself to rest in understanding.